Gentlemen, I am Dr. Mohammad Rashid Al Kabir, Associate Professor, Department of Microbiology, Joint Secretary, DAB, CBMCB branch, and it is my absolute honor to moderate today's scientific seminar on hypertension, the silent killer, which is organized by the Department of Cardiology and DAB CBMC branch. We have a distinguished panel to expert and guest with us today to bridge the gap in our understanding on this critical health issue. Now, I am inviting our chairperson, Professor Mahfizur Rahman Khan Chaudhary, to come to the dais with chief guest Dr. Muhammad Jairul Islam Shakil, special guest Professor AKM Khalikuজ্জামান Dipu, co-chairperson Professor Dr. M. Karim Khan, co-chairperson Professor Dr. Muhammad Murshid Alam, co-chairperson Dr. A.H.M. Hassan, Associate Professor Community Medicine, President DAB CBMC branch with us. Now I would like to request our panel expert, Professor Muhammad Aminul Islam, Head of the Department My Medicine, CBMC, Emdadul Haq, Associate Professor, Department of Cardiology, CBMC, Dr. Parvez Ahmed, Assistant Professor, Department of Cardiology, to take the dais. To begin our scientific discourse, I would like to invite our imitated keynote speaker, Dr. Tofayel Ahmed, Associate Professor and Head of the Department Cardiology, CBMC, General Secretary DAB, CBMC branch. He will present on hypertension, the silent killer, the bridge gap in prevention and management. Now I am inviting Associate Professor and Head of the Department of Cardiology, Tofayel Ahmed, to take the floor. Thank you.
Bismillahirrahmanirrahim. Honorable Chairperson, respected Co-Chairperson, distinguished guests, respected faculty members, my senior and junior colleagues, and my dear student. Assalamu alaikum and very good morning to you all. First of all, I would like to thanks and gratitude to our college authority to allow us to organize this scientific session. I am deeply honored by the presence of our chief guest. Your participation is give us a dimension for this event. I I would like to thanks and gratitude to our chief guest for their presence and inspiration with us. Without further delay, I would like to start my presentation. Hypertension, the silent killer, bring the gap in prevention and management. Dear audience, close your eyes for a split second and imagine a ticking time bomb. No sound, no red lights, just a countdown. That bomb is inside one of every three adults in this room right now. That is hypertension. What is hypertension? Traditionally, hypertension is defined as 140 to 90 higher. However, now new guidelines set the limit at 130 to 80. This change happened because doctor realized that even slightly high blood pressure can increase the risk of heart disease. Hypertension, the silent killer. High blood pressure often has no warning sign but can damage silently damage your body over the time and leads to life-threatening complication. Why hypertension is called silent killer? Most patients are asymptomatic. Damage occurs gradually over years. Often the first presentation is catastrophic. Uncontrolled hypertension can lead to catastrophic complications like stroke, myocardial infarction, and heart failure. So, absence of symptoms does not mean the absence of disease. According to World Health Organization, globally 1.2 billion people worldwide with hypertension. Out of them, two-thirds lives in low and middle income countries. Only 20% have the adequate control. A massive gap between the diagnosis and effective management. In the Bangladesh context, hypertension prevalence is rising rapidly due to urbanization and lifestyle changes, high salt intake, limited healthcare access, and low public awareness. Community level intervention is essential. Risk factor can be divided into two types: non-modifiable and modifiable. Non-modifiable age, genetics and gender, and modifiable high salt intake, obesity, physical inactivity, smoking, and alcohol. This factor can increase the risk of high blood pressure and heart disease and stroke. In our region, dietary salt plays a particular important role. Pathophysiology. Pathophysiology of hypertension results from the complex interaction among the hemodynamics, neurohormonal, and endothelial factor. Increased systemic vascular resistance, vascular overactivation of the renin-angiotensin system, sympathetic overactivity, and endothelial dysfunction. Sustained elevation of arterial pressure causes vascular remodeling. Long-term consequence is target organ damage. Classification. Different guidelines classify hypertension differently. The key message is risk start from 120 to 80 millimeter of mercury. The higher the BP, higher the cardiovascular risk. So classification is less important than the overall risk assessment. Risk being increased 120 to 80. New guideline threshold is 130 to 80. And traditional definition is 140 to 90. Even slightly elevation of blood pressure initiate cardiovascular risk. Therefore, arbitrary classification is secondary to overall patient risk assessment. Diagnosis. Diagnosis should not rely on the single reading. Accurate diagnosis of hypertension require multiple measurement, like people office BP measurement, home BP monitoring, ambulatory blood pressure monitoring. Diagnosis should not be based on diagnosis based on consistent elevation of blood pressure throughout the method, not only single reading. Identify the white coat and mask hypertension. Both are important for prognostic implication. In treatment, lifestyle modification is the cornerstone. Salt restriction, regular exercise, weight reduction, smoking cessation, and healthy lifestyle habit. Even small reduction in blood pressure singly reduce the cardiovascular risk. Systolic blood pressure 10 millimeter, diastolic blood pressure 5 millimeter reduce the 20% cardiovascular complication, 27% stroke complication, 28% kidney disease, and totally 13% reduce the mortality. Small changes today, big benefit tomorrow. Treatments on drug. Mainly SC inhibitor, ARB, diuretics, and calcium channel blocker are the main drugs. We need the combination therapy. Why you need combination therapy? Hypertension is a multifactorial involving various system. Combined drug strategies, different pathway, improve overall blood pressure control, and can be more effective with fewer of the side effects. Gap in prevention, major gap in the hypertension care. Many patients remain undiagnosed until the complication occurs. Lack of awareness, inadequate screening, cultural dietary habit, and late diagnosis. Bring this gap through the awareness, regular screening, healthy lifestyle choice can prevent the complication and save life. Gap in management. Even after diagnosis, key barrier to effect the blood pressure control due to poor adherence, irregular follow-up, cost issue, and physician inertia. This result poor BP control. Less than 1 in 5 people with hypertension have the BP under have their BP under control all right. Bridging the gap. We need multi-level approach. The achieve better blood pressure, to achieve better blood pressure for all. Public awareness, primary care strategies, risk stratification, tasks shifted to the nurses and health worker, and affordable medicine access. Hypertension is not just a clinical issue but a public health problem. Role in technology. Technology can help us to control hypertension through BP tracking apps, telemedicine consultation, medicine reminder, digital log, improve the adherence and follow up. We can help technology. Prevention strategies. Prevention are two types: population-based strategies, individual-based strategies. Population-based strategies, salt reduction, public education, and community health awareness. And individual-based strategies, early dietary screening, BP checking, structural lifestyle changes, and consistent clinical follow-up. Both pillars must function together to control the national hypertension burden. Takeaway message. It is leading cause of preventable death, often kills without a single warning sign. Don't wait for symptoms, detect it early. By combining lifestyle changes with medication and improving our healthcare system, we can stop the silent killer in its track. In World Hypertension Day, May 17, let us know the vital message to mind. Measure your blood pressure accurately, control it effectively, and live a long, healthy life. Check blood pressure regularly, eat healthy, stay active, manage stress, and avoid the tobacco and alcohol. Thank you for time and attention. Let's continue to work together, control hypertension and build a healthy future. সবশেষে আমাদের প্রাইম মিনিস্টারের সাথে সুর মিলিয়ে বলতে চাই, উই হ্যাভ এ প্ল্যান, লেট আস বিল্ড এ সেফ for all for Bangladesh. Assalamu alaikum.